Your physician has scheduled you for heart surgery. This program will show you what to expect when you go for surgery and how to get ready. It is very natural to feel nervous about surgery, but a positive attitude can help. It's your best prescription for a speedy recovery after surgery. The better prepared you are, the more relaxed you will be. So be sure to discuss your questions and concerns with your doctor and your nurse coordinator. The heart is a muscle, and like all muscles, requires energy and oxygen to work. It is supplied with blood by a system of arteries originating from the aorta. They are called the coronary arteries. There are 4 valves in your heart which act like one-way doors. They let blood in and out of the heart's chambers each time it beats. Heart valve surgery replaces or repairs damaged or scarred heart valves. Your surgeon will explain what is needed in your case. Open heart surgery is often done with use of the heart-lung machine. This machine pumps blood for the heart and adds oxygen for the lungs while the heart surgery is being done. When surgery is finished, the heart resumes its work of pumping blood throughout the body. Sometimes your surgery can be performed off the heart-lung machine. Your surgeon will determine what is best for you. Coronary artery surgery bypasses the blockages which hinder the blood supply to the heart. Blood vessels taken from inside the chest, the arm, or the lower leg are attached to the coronary artery below the blockage, thereby restoring the blood flow. This aids in relieving chest pain and improving heart function. Coronary bypass surgery is a remedy, not a cure, for coronary artery disease. The disease which led you to this operation is still present, so changes in eating habits and lifestyle will be a large part of your recovery. Your surgeon may order tests and an education session prior to your admission. You'll be given a packet of information personally tailored to your healthcare needs. A DVD copy of this program is available, as well as a tour of the facility. A member of your family is encouraged to attend the teaching session along with you. Specialized nurse coordinators and nurse practitioners are available to assist you prior to and after your surgery. A phone number is provided for you to reach the surgeon and the nurse coordinator if needed. Additional educational assistance such as interpreters, hearing devices, closed captioning, and visual aids are also available. Please notify the staff of any special needs you may have. If you are hospitalized and have not attended the testing and educational session, your testing and education will be provided at the bedside. Before surgery, you will be expected to abstain from alcoholic beverages after the evening meal and refrain from smoking. Don't eat or drink anything after midnight. You may take your prescribed medications before midnight, and your physician may instruct you to take some medications after midnight. Once you are admitted, your medications will be provided for you. Bathe or shower 2 to 3 times before surgery with a prescribed antibacterial soap. This soap should not be used on the face or near the eyes. Prior to surgery, you may have some hair removed from your chest, arms, or legs. This will be completed with specialized clippers at the hospital to limit microscopic nicks to the skin and aid in preventing infection. The nurse may insert an IV port, and IV fluids may be ordered prior to surgery. Patients having early surgery may be taken down to surgery as early as 6:30. Family members are allowed to come to the patient room prior to 6:30 the morning of surgery if desired. If you are scheduled for later surgery, your family should arrive around mid-morning. Pre-operative medication is given at the appropriate time. This may make you relaxed and drowsy. All jewelry must be removed prior to surgery. Give any valuables to family members for safekeeping. It helps many patients to have someone to talk to about their feelings concerning surgery. For this reason, a chaplain often visits. You may have a chaplain of your choice or one from the hospital. The anesthesiologist will visit you before surgery. Your medical history will be discussed, with particular attention paid to the following: allergic reactions, or if you have ever had any side effects from anesthesia, such as nausea or vomiting associated with a previous surgery. Total time involved in surgery varies. It usually takes approximately 4 to 6 hours, and you may go to the pre-op holding area before going into surgery. The patient's family will be directed to a surgery waiting room. A pager is usually assigned to the patient's family for ease in locating the family during the surgical period. Updates on the progress of the surgery may be given to your family by the surgery liaison, surgical nurses, or by telephone. Volunteers are present to assist families in all waiting rooms. Following your surgery, your surgeon will speak to your family members. Your family will be informed when to proceed to the family waiting room of the Cardiothoracic Care Unit, known as CTCU. The first 1 to 2 hours is the post-anesthesia phase, and visitors are usually limited during this time. CTCU provides a high level of medical monitoring that is necessary while you are on the ventilator and need intensive medical care. The room monitor gives continuous readings of your condition. A similar monitor is also watched at the main desk, located at the nurse's station. You will be in the CTCU the day of your surgery and probably transferred to the step-down unit a day or two after surgery. About 2 hours after transfer to CTCU, your entire family will be allowed in for the first visit. A phone is located in each waiting room on the second floor in the northwest corridor near CTCU. Your family must use the phone before each visit. CTCU has open visiting hours but asks that only 2 or 3 people visit at one time. One family member is allowed to stay overnight with the patient if desired. Your family may call CTCU anytime, day or night, to check on your progress. Phone numbers for CTCU, payphones, and lounge phone are also provided in your cardiac manual. Waking up after surgery is a gradual process. Your family may notice the presence of many lines or tubes. You will have a breathing tube connected to a ventilator to help you breathe during surgery and may remain in you until you are fully awake. Try to relax and let the machine breathe for you. You will not be able to talk while the tube is in place. Remember, these were attached in the operating room and remain in place for a relatively short period. Temporary pacemaker wires may be attached to your heart as a precautionary measure. These are fine wires that come through the skin just below the chest incision and can easily be attached to a pacemaker if needed. If not needed, they will be covered with a dressing until removed. A catheter is placed in your bladder after you are asleep in the operating room and allows close monitoring of kidney function. It is removed 1 to 2 days after surgery. Chest drainage tubes will be placed in your chest near the bottom of your incision during surgery. These tubes drain the blood and fluid that collects in the chest after heart surgery. They're usually removed 1 to 2 days after surgery. When the breathing tube is no longer in place, you should ask for pain medication whenever you need it. Your nurse may ask you to rate your pain level on a scale of 1 to 10. You should ask for pain medications when your pain level is at a moderate level. Do not wait till your pain is at the high end of the range to ask for pain medication. A successful recovery depends on you being comfortable enough to cough and breathe deeply and participate in cardiac rehabilitation activities. Medication needs may be adjusted in the immediate postoperative phase. IV insulin will be used in all heart surgery patients usually 1 to 2 days after surgery. Medications may be given to help get rid of extra fluid. It may be necessary to limit the amount of fluids you take the first day or two after surgery. Your family should check with the intensive care nurse before giving you any fluids. Anytime general anesthetic is used, the lungs collect extra fluid. After surgery, your lungs need to be re-expanded and the air sacs opened. You will begin using your incentive spirometer as soon as you no longer require the ventilator. Consistent, faithful use of the spirometer will result in early discontinuance of oxygen and faster recovery. You will need to continue to use the spirometer for at least a month after you go home. Coughing and deep breathing exercises are very important after surgery. Sore chest muscles cause you to take shallow breaths. Using your heart hugger or holding a small pillow to your chest incision will help relieve the discomfort. You will be assisted out of bed soon after the breathing tube is removed. Getting out of bed is easier if you raise the head of the bed, move closer to the edge, and roll to your side. Swing your legs to the floor and sit up sideways at the same time. You may use the side rails for support, but you should never pull yourself straight up using the side rails. Sit on the side of the bed for a few minutes to make sure you are not dizzy, then stand up. Early out-of-bed exercises also assist the lungs to re-expand. You need to sit in a chair for each meal. Although you are able to resume a normal diet, you may find that you don't have much of an appetite. Anesthesia and some medications temporarily affect the taste buds and the appetite. You will be transferred to the step-down unit when you no longer need intensive monitoring. These are private rooms, and a family member may stay with you if desired. Children are welcome on the step-down unit. However, they are not permitted to wander about the room or the hallways. Children who become fussy should be taken from the unit. Your care will be provided by registered nurses and nursing assistants working as a team. The focus of your care on the step-down unit will be to increase your independence in preparation for going home. During the recovery phase, some patients may need to wear elastic stockings to increase blood flow and reduce swelling in the ankles. Your physician will decide what is best in your case. After surgery, your walking and level of self-care will be increased progressively. The physician, nurses, and cardiac rehabilitation staff work as a team to determine when cardiac exercises are appropriate for you. The cardiac rehab staff will introduce you and your family to the exercise program. You will begin with assisted walking and may progress to low-level arm and leg exercises. These exercises are designed to help improve circulation and lessen the discomfort of sore chest muscles. The exercises are listed in your cardiac manual. Rest periods of approximately 30 minutes before and after exercises are recommended. Some patients find it helpful to take pain medication approximately 1 hour before cardiac rehab exercises begin. Progressive walking is helpful to your recovery. You will walk around the unit starting with 1 lap and then adding a lap as tolerated, with the maximum being 6 laps. If you are on oxygen treatment, the cardiac rehab staff will monitor the oxygen in your bloodstream before, during, and after activity until the treatment is discontinued. To help the staff determine when you are ready for discharge, it is important that you do as much of your own care as possible. If you or your family have any concerns about your home care needs, discuss this with your nurse coordinator or nurse as early as possible. Someone from social services may be contacted to help you make arrangements. You will probably be able to do most of your own care now, and your heart monitor and pacer wires will be removed. Before discharge, your doctor and nurse review all medications and provide you with a written medication schedule for home use. Written discharge instructions will be provided by your nurse, nurse practitioner, or doctor to guide you in your continued recovery at home. Avoid heavy lifting, not over 25 pounds, or strenuous activity for the first 6 weeks. After 6 weeks, you may gradually return to full activities and exercise. Wait 6 to 8 weeks before very heavy lifting. You may start driving when you are no longer taking narcotic pain pills and you are able to walk and climb stairs without difficulty, usually 3 to 4 weeks after surgery. Refer to your cardiac manual for more information about things you can do and shouldn't do immediately after you go home. When you go home, you may feel tired at first. This is only natural. You should continue to complete your cardiac exercises, daily progressive walks, use your incentive spirometer, and gradually increase your activities to a normal pace. If you feel tired, rest in order to let your body heal. Constant bed rest is not, however, a good practice as it significantly lengthens recovery time. Stay home the first week. Someone should be with you portions of each day to assist you. Keep visitors to a minimum and avoid coming into contact with persons who have colds or flu for at least the first 2 weeks after you return home. Call your surgeon if you have a temperature of 100 degrees for more than 2 days, a weight gain of 3 pounds from one morning to the next morning or 5 pounds in a week, redness, swelling, increased soreness, or drainage from your incision. Some clear drainage from the leg is normal, but report any drainage from your chest. Call your cardiologist or surgeon if you have chest pain like you had before surgery. If you have any questions about your medications, or have changes in your heartbeat that cause your heart to beat too fast or too slow, or to skip around. After discharge, many patients participate in Phase 2 and 3 of the Cardiac Rehabilitation Program. This program consists of increased monitored exercises along with educational classes. These sessions include discussions about risk factor modification such as smoking cessation, controlling blood pressure, diet modification, coping with stress, exercising on a regular basis, watching your weight, and controlling diabetes. Our goal is for your stay to be as pleasant as possible, for you to be able to return to the activities you enjoy, and experience how we are called to care.